Time now for Doc Talk. This is our segment where we answer your medical questions that you have sent us every week. So we have Dr. Amy Cobb joining us now here from University Health, internist and pediatrician. So thanks so much for being here.
Thank you.
We got a good list of questions. First one up is from Esther S. She's asking about Bell's palsy. Guarantee I'm going to have a follow-up here.
Yes.
Does Bell's palsy ever go away, and is it ever too late for physical therapy?
Sure. So to start off with, just so we all know what Bell's palsy is, it's a weakness on one side of the face. And we don't know exactly what causes it, but we think it's often linked to infections, but also some non-infectious causes like pregnancy and diabetes. So the important thing is when you think you have Bell's palsy, you should see your doctor, and getting steroids early can really help you. In terms of recovery, about 70% of patients will recover spontaneously within 3 to 6 months without treatment. But with the steroids, that goes up to 80 to 85%. So that's why I'm saying go see your doctor about it. There are other treatments like antiviral medicines that we sometimes use, and then eye care is very important. So, you know, when I say one side of the face is weak, that includes the ability to close your eye. And if the eye gets too dry, it can cause permanent damage. So that means like patching your eye at night and using lubricant drops. In terms of the physical therapy question, there's really not very strong or robust data to tell us if it helps or it doesn't. There's some small studies, so it's something that you can do. But one thing I would bring up is that, you know, this listener said that, you know, if it's been too long. So I'm thinking that maybe they've had this already for a while. If it's been more than 3 to 4 months, they should go see their doctor again, even if they went initially, because it's time to do more investigation to make sure it's Bell's palsy. So an MRI or a CT scan of the brain, they can do nerve testing to see how damaged the nerve was, and they can sometimes see signs of recovery on that nerve test.
Yeah, so I dealt with this 5 years ago. That's what I went through, making sure there wasn't a stroke at play or something like that. And it's a helpless feeling. You want to feel like I just need to do something, but time, I know, is really important. But is there anything that somebody can do to put their body basically in a better place to heal? Supplements, something you can eat, a way that you can kind of prime yourself for that healing.
Question, right? So universally, inflammation is bad for the body, okay? So that's why we think like infections can cause it. You know, diabetes can cause it because that inflammation. So anything you can do to lower your body inflammation, and there's, you know, it's the basic stuff, guys. Eat a healthy diet, get enough rest, manage your stress. That's kind of like the global thing, I would say, because otherwise you can't always manage the other risk factors.
Yeah. And take care of your eye.
Take care of your eye.
Take care of your eye.
All right, next question is near and dear to me. I have a mother who suffers from dementia and Alzheimer's, and Letty has a question about her mother. She's been showing signs of dementia. Being a strong woman all her life, she is stubborn and afraid of what that means. The prescription that she got made her too sick, and she wouldn't take it the 3 weeks to adjust. What alternatives are there, and how do I help if she doesn't let me talk to her doctor?
Right. So I would start off by saying, you know, it's common that people experiencing dementia might be in denial about it, right? So, or I should say that there'll be resistance to help about it. So one reason could be that they're not aware of their symptoms, the ways their personalities are changing, the personality is changing, or the way that they may be having memory problems. But another thing could be, you know, especially in this woman who's strong and independent, maybe she's aware, but she needs that time to adjust and she's just not ready. So one suggestion might be is instead of putting the focus on her and being like, Mom, I want to go with you because I'm worried about you, you could reframe it and be like, well, I want to learn from you how I can protect myself, how we can protect your grandkids, right? And maybe she can get in the door, talk to the doctor, and, you know, just kind of start on that path. The other thing I want to bring up is if this dementia is pretty advanced, we have to think about if the mom has capacity to make a decision. So we use this concept of medical capacity, and it has 4 components. So 1, do they understand the situation? 2, do they understand, you know, the risks and benefits of treatment or not doing a treatment? Can they explain their reasoning? And then can they express a clear decision? So someone could have capacity for a simple decision like, do I want my flu vaccine, right? But not a more complex decision like, do I want this experimental drug and this research study? So a same person can have capacity for some things and not others. If we think she doesn't have capacity, then that's when a surrogate decision maker comes into play. And I just want to put in a plug for getting your medical power of attorney and your advance directive before you're sick, because that allows you to say, who do you want to make decisions for you? What are your values? And that can be really helpful for whoever is having to make a decision to understand when you were in your prime, like what were the things you valued?
Yeah, and power of attorney really lets the mother decide who she wants to make these decisions, and that's the go-to person. You don't have like a committee of people going in a bunch of different directions.
That's right.
Yeah.
Okay, our next question is from Jessica. Can you talk about BVD, that's binocular vision dysfunction, and what are some of the resources to help make an accurate diagnosis and find treatment?
Okay, so to start with, a quick check for this is if you can look through both eyes and it's blurry, and then you cover one eye and it's clear, then that's what BVD is, okay? So it just means that your eyes are not able to, they're misaligned and they're not able to focus when they're both open. So this could be because of a problem in your brain, in your eye socket, or with the muscles that control your eyes. So the way to start would be to go and see your eye doctor, to check for this. And they may end up recommending an MRI or a CT scan. They may recommend some labs, or you might need to see a neurologist or a neuro-ophthalmologist. If no, concerning cause is found, then sometimes it's just a prism in your glasses can give you some relief.
Okay.
By the way, when you're giving that answer, I saw Adam Caskey over there.
I did too. Yeah,
checking his vision. So yeah,
he's
he's
all, you good?
Yes.
Okay,
Yeah.
he's good.
Okay, good.
All right. Thank you so much, Dr. Cobb. I appreciate your time.
Oh, absolutely. Thank you.
Yeah, and thank you, our audience, for sending in all those great questions. We have much more we wanted to get to, but we got talking about different things. So we're still taking questions, though, and we've still got some we're going to give to the good doctors that join us. Hit this QR code, submit your questions. We will ask them on the air.
Keep up to date with all of San Antonio's top news, weather, and so much more by clicking the like and subscribe buttons below. And once again, thanks for watching KSAT.